Hello friends, our today's topic of discussion is development of occlusion. So coming to the stages of occlusion, we have basically four main stages of occlusion. First is predentate period, second is deciduous or the primary dentition, third is mixed or transitional phase, and the last one is permanent dentition. Predentate we have already discussed in my previous videos. So today we will be discussing mainly about the deciduous or the primary dentition development. So primary dentition, as we know that the first primary tooth erupt is mandibular central incisor, which erupts at 4 to 10 months of age, but its initiation started at 6 week of intrauterine life. So to establish the proper occlusion of primary teeth, it takes 2.5 to 3.5 years. Now coming to the primate spaces. Primate spaces or also known as anthropoid spaces or simian spaces. It is called simian spaces because initially it was found in our ancestor or the simian species. Primate spaces are those spaces which are present between the primary maxillary lateral incisor and canine in maxillary arch, and between the primary mandibular canine and primary mandibular first molar in case of mandibular arch. So in maxillary arch it is between B and C, and in mandibular arch it is between C and D. Now coming to the physiological spaces, it is the normal generalized spacing present in all primary teeth, and it is very important for eruption of permanent teeth and to prevent crowding in the permanent teeth. And in case of maxillary arch it is 4 mm, and in case of mandibular arch it is 3 mm. Now third one is non-spaced dentition. If in primary teeth there is no spacing between the teeth, then it may leads to the future crowding of the permanent teeth. Now coming to the terminal planes. Terminal plane is the mesodistal relationship between the distal surface of the maxillary and the mandibular second deciduous molar. As you can see in this figure, this is upper E and this is lower H, and this is the distal surface. There are three types of terminal plane: flush terminal, mesial step, and distal step. Flush terminal is, as you can see in this figure, the distal surface of upper and lower is coinciding, and it is most favorable for class 1, and it occurs in 74% of the population. Second one is mesial step. It occurs in 14% of the population, and this mesial step is when the lower mandibular second deciduous molar is slightly mesial to the upper E, and it is most commonly converted into class 3. The third one is distal step. In this, the mandibular primary second molar is slightly distal to the upper primary second deciduous molar, and this converts into class 2, and it occurs in 10% of the population. So the flush terminal is the most common and distal step is least common. Now coming to the anterior teeth relationship. Anterior teeth relationship, we have overbite, edge to edge, and overjet. Overbite is nothing but the vertical overlap between the maxillary and the mandibular teeth. And in case of primary dentition, it is 2 mm. Whereas edge to edge bite is where there is no overbite, example in case of attrition and in case of lengthening of ramus. Overjet is the horizontal overlap between the maxillary and the mandibular teeth, and it is generally 1 to 2 mm. Now coming to the canine relationship. Canine relationship is the most stable in the primary dentition. It is of 3 class: class 1, class 2, and class 3. This is the primary lateral incisor and primary canine, upper and lower. So in case of class 1, The primary mandibular canine interdigitates in the embrasure present between the upper lateral and upper primary canine. Whereas in case of class 2, the primary mandibular canine interdigitate distal to the embrasure, and this will convert into class 2 occlusion. In class 3, it will be in the any other position. Now coming to the arch dimension. It was given by Zsigmondy in 1890. As you can see in this picture, we have the full arch of teeth, and here we have from central incisor to the second molar. This is A, which is known as arch length, and B1 is the distance between the canine, known as bicanine diameter, and B2 is known as bimolar diameter, distance from the one molar to the another, and arch perimeter is the distance from the mesial surface of first primary molar to the another mesial surface of the first molar in the arch.